If you or someone you love is a neuropathy sufferer, or if you're concerned that maybe you're developing neuropathy, I'm going to give you today a simple at-home test that you can do, as well as a rehabilitative therapy. Because most people don't understand that the first nerves that are affected in a neuropathy case are what is called LDAs. LDAs are large diameter afferent nerves. And what that means is they send signals from the feet to the brain, okay? But they do not sense pain. So what do they sense? Well, they sense positioning, okay? So they tell my brain where my feet are in space. They tell me if I'm upright or if I'm not. They also sense normal sensations, okay? So we're going to look at tests now that we can do to test our LDAs to see if we're beginning to lose neuropathy, or starting to have neuropathy and lose function, okay? Now, why are LDAs affected the most? Because they are the most myelinated nerves. That means they have the biggest coating on them, and they're the fastest nerves, okay? So with a neuropathy, you begin to lose this coating. Now, so losing the coating is similar to like the plastic or rubber that's on a wire, protecting a wire or insulating a wire. So what happens when you lose that, it's going to short out, right? So when you completely lose that, you are going to see now the pins and needles and other type of symptoms that you might expect with a neuropathy. But long before that starts happening, you're going to start losing myelin and losing nerve function. And so you're going to have subtle changes that you may not know is associated with neuropathy. So how do you find out? I'm going to give you something you can pick up off of anywhere, okay, on the internet. Look for a handheld vibrator, okay? And what you're going to do is you're going to take the vibrator, you're going to just turn this little thing on, and then you're just going to check vibration sense in your foot. Look at your toes and different sides, and just see, does it feel the same as my hand and my shoulder? If this is a 10, and this is a 10, and this is a 5, you have a problem. If this is a 9 or an 8, you're beginning to develop a problem already. You should have the same vibration sense. So what can you do about that? This can also be a rehabilitative tool, because one of the things that you have to do with neuropathy in order to help neuropathy is begin to get normal sensation back into the nerve. Now there's other things I'm going to talk about, but just for this, just using this vibration on your foot or wherever the neuropathy is occurring will help to restore normal function again. So if you don't know, get something, test it. Now I'm going to give you one other simple test that you can do. This is called light touch. So you can do this yourself, but it's easier if you have somebody else do it. So you take and you run your fingernail just down your leg, especially along your foot, to see, do you feel the same on one side as you feel on the other? You could take some kind of instrument, something like a stick or something like that, or even a feather, and just see, does it feel the same? Even a pencil or a pen, does it feel the same on one side as the other with light touch? Another indicator if you're losing the large diameter afferent nerves and beginning to suffer with neuropathy. Hope this helps you. Hope if somebody in your loved one is having these kind of concerns, check it out and live life well. And I'll see you next time. God bless.